I don't know what to think. I just think that it's very unfair.
Well, continuing this theme here, that's the message from a healthcare worker at PeaceHealth Southwest Medical Center in Vancouver, Washington this week. These photos shared with the story team are from a small protest that staff held inside the hospital. On May 22nd, PeaceHealth announced that starting June 21st, they're making a 1% workforce reduction, including eliminating some caregiver roles and closing some open positions. Rhonda Ferrier, who has been a CNA since 1978, is part of that 1%.
Well, we got notification on May 22nd that our program is going away and we're all being laid off.
For the past 3 years, Rhonda has worked as a mobility aide, helping patients with daily activities like brushing their teeth and walking.
It's going to hugely impact patient because we did a study that proved that mobility or mobilizing patients shortened their length of stay, so they got home quicker. I don't feel valued at all, and our work isn't valued, I don't think.
Okay, along with eliminating mobility aides like Rhonda, the hospital is cutting supply chain specialists like Samuel Roberts. Now, he makes sure nurse stations and medicines are fully stocked.
Those stations up there can get a little chaotic anyway, and so that's what we're there doing, is trying to keep it organized for the nurses to spend more time with the patients. So I think it's a direct correlation that they're going to have less time one-on-one with the patient. Because my reaction when I heard this news was frustration and confusion, because I went through orientation on April 1st, and so I'm real new to all of this, and I was laid off May 22nd.
A spokesperson for PeaceHealth told KGW that no one on the management team was available to talk on camera, but they sent the following statement instead, and it reads in part, PeaceHealth announced reductions to its workforce on May 22nd after months of discernment, financial analysis, and a thorough review of the dynamic healthcare market. We are making a 1% reduction in our workforce of 16,000 caregivers system-wide. Now, for those caregivers represented by a union that were impacted by the reduction, we are following the bargaining process.